It's a pleasure to catch up with Mr. Arun Arora, CEO of the Shroff Charity Hospital in New Delhi. Mr. Arora, this hospital has been extremely active with regard to dealing with vision issues. And you get hundreds of thousands of patients who come in. Among these patients, how many of them have issues with refractive error, just need for a pair of glasses?
Well, about 80% of the people who visit us do have need for refractive error, and they give glasses. And I was very worried that we were all the time looking for surgeries and diagnostics, and refractive error was important, but not that important. So initially we recently took some initiatives where we have now started measuring our quality vis-a-vis refractive errors. And this is probably, I have checked it out with many people, nobody is doing it in the country in a very scientific manner to measure how our optometrists do the refractive error, what is their quality, what is their output, what is their, we calculate standard deviation, etc.
Right.
From what is correct. So to us it is very important, and about 80% people do come with refractive errors.
Then in terms of your technical staff here, what would you think the mix be between optometrists and others, with regard to your staffing within your hospital?
If I'm right, I wouldn't remember the figures offhand, but if I'm right, we have about 60 optometrists.
That's a large number.
With us. That includes our fellows and trainees, but they are all optometrists. Either they have done, most of them have done their 3-year BSc degree course, and they are in internship with us. Now, the doctors would be about 20, and that would be the ratio. Nurses would be a similar figure of about 50.
And I also understand you do a lot of work in rural India, especially in places like Uttar Pradesh. And I would imagine, a similar situation exists there, where the majority of people would need, treatment for uncorrected refractive error, just need of a simple pair of glasses. How do you think the profession as such, the optometry profession, should approach this, especially when it comes to the rural parts of India?
You see, my own personal opinion is that the number of optometrists in the country is far too few. I think until and unless they increase by large numbers, so that they are able to go to the rural areas and tier 2nd and 3rd tier towns, this problem will remain.
Right.
Refractive error will not be addressed, and the optometry profession as such will not become known in the country. Therefore, temporarily, to my mind, we will have to do with the concept of vision technicians and vision centers, etc., to address large number of the population in the rural area. Especially in UP, we have started opening vision centers with a 2-year formal training.
Right.
That's the way we are going about it.
And the last question is, as a hospital that is doing extremely well, and you've been nurturing optometrists, you've got highly skilled workforce here, are you looking at the training aspect in terms of how you could probably assist in training more optometrists in future, in terms of doing any kind of formal programs or anything like that here?
You see, we do a lot of programs of 1-day training, 2-day training times for optometrists. However, if you can call accredited programs, I think we have been a little shy because of the efforts that you require to get the accreditation from some university, etc. It's been though with my vision to start a good BSc. We did start one with IGNOU, but IGNOU whole thing fell apart. But we would be keen to look at a BSc program, or maybe a diploma to begin with, then a degree program in optometry in the near future.
Thank you so much for your time and congratulations on everything you've done and my best wishes for the future. Thank you.
Thank you.